It has been a journey of highs and lows in the fight against the COVID-19 pandemic. And the 100-mark death toll is one such low that the country has been dealt, as millions of Kenyans stare at a peak in the number of infections. 152 people have tested positive for the virus, bringing the total of positive cases to 3,457. Well, the country is now bracing for impact as the number of infections approach the peak.
The Center for Disease Control earlier stated that wearing a mask may stop those with COVID-19 from unknowingly spreading the virus. And as the country marks a grim milestone in the number of deaths, this may be the only saving grace.
The use of the face mask is one of the easiest containment measures that has been put in place. Unfortunately, some of us put on their masks, but what I would call it is at half mast, so that it is at the chin level, or is the wrong mask, or no mask at all.
The 100 deaths announced today brought home the stark reality of the wispy line between life and death, as the number of infections is expected to peak in August. That the virus has had a domino effect on every sector in the country is indisputable. Snarl-ups continue to pile along the Malaba border, owing to the long lines caused by truck drivers waiting for COVID-19 clearance to cross the borders. The battered economy is now crawling to recovery, and following the president's directives to ease some restrictions to allow for businesses to operate, many sectors have since reopened. However, some questions lingered on the operating times for restaurants, given the fact that the president adjusted the curfew times from 9 p.m. to 4 a.m. The government has now corrected its earlier position on the closing hours for restaurants.
The closing hours for restaurants and eateries is 5 p.m. We want to correct that. It's 5 p.m. However, this is under discussion, and as soon as decisions are made as to when the cutoff time is, it will be communicated.
The new infections point to the troubling threat of community transmissions as the government rolled out home-based care as it prepares for a spike in the number of infections. Gena Kirori, NTV.